Hello and welcome to Business on the Wire. If 2020 was about the raging pandemic, the year 2021 has become already about the race for vaccines. Several countries, including India, are in a rush to ensure that their frontline workers, their healthcare staff, and their sensitive populations are vaccinated at the earliest. But is that rush for a vaccine coming at the cost of scientific thought and process? And what are the deeper scars that developing countries across the world may have to bear, both in economic and health terms? Even as we speak, new variants of COVID are now at play in countries like the UK and in South Africa as well. What does the year look like, both medically, and what are the key questions to be answered with regards to vaccines? Joining me to talk about that is Dr. Faheem Younus. He's VP, Chief Quality Officer, and Chief of Infectious Diseases at the University of Maryland, UCH. He has, of course, been a prolific speaker about COVID and how to guard oneself against it on social media platforms where he has a huge following. Thank you so much, Dr. Younus, for taking time out and speaking with me. I want to start with what 2021 has been about, which is the vaccine and the global rollout of it. From what we're seeing so far, though, it looks like things are moving much slower than expected in terms of targets that have been set even within countries like the US. What to your mind is slowing the process down, and would you worry about that at this point?
Great question, Mitali. First of all, it's not about the speed, it's about the accuracy. So I actually get worried when I get this sense in the media and even among the scientists about a push for speed. Because as physicians, we all know that it's accuracy, it's precision that matters. I always tell my patients, look, I'm not going to be your fastest doctor. I'm going to be thoughtful, careful, deliberate. Yes, there are times in an emergency room when speed matters, but overall precision. So number one. Number two, anytime you roll out an unprecedented level of vaccination like this in any country, you're bound to have hiccups. Number three, there is no denying that we have not been united as mankind. You can call it politics, you can call it our personal interests, you can call it whatever. And this is true for United States. I'm sure it's true for many, many countries. So when you put all those factors together, then delay is not anyone's blame. It's a consequence of all of that. So I would want everyone to be thoughtful, deliberate. And the last point on this is it's not like we don't have an alternative. Our current alternative of wearing masks, avoiding crowds, washing our hands is keeping us safe. So yes, I am very much interested in speed up of this process, in fast access to people, but never compromising safety or quality in the process.
On that point that you raised about alternatives, Dr. Younus, what's also been worrying is the kind of surge we're seeing across many pockets. London, for example, has declared a state of emergency. China is shutting down some areas again. Would you say this is a consequence of us having let our guard down? Or would you say this is just the nature of what we're struggling with, where it's not going to be there is no second wave, right? It's just been this ongoing tidal wave of one area after the other.
Sure. And I think once again, it's nuanced because it's different for different countries. When South Korea has more cases, I can't say there's anything that they did wrong and they could have done differently. That's where I would say it's the virus. But when things happen in London or UK, we know that their policy was so botched that they were on two extremes, that they seriously entertained the idea of herd immunity, that they seriously prioritized their economy over the veracity of this virus, that they seriously had disconnect in policy or in US for that matter. So there, I'm not going to blame the virus. I think these countries have huge infrastructure, huge capacity. And for us to be in this situation, we need to introspect. I think it's more on us than the virus. So it varies from country to country.
Are you worried about the developments in terms of new variants of COVID, though, Doctor? I mean, we're talking about, of course, what's happened in the UK. There is talk about the South African strain. The mink population as well has been identified as, providing a particular strain. Are these all new strains or just the nature of the virus where it can mutate into these different forms?
Great question once again. So Number one, we don't know everything. And I'm the first one to always admit that. I'm not Mr. Know It All. I think this virus has taken us by surprise. And I'm deeply grateful to those who are really working behind the curtain in research labs, trying to figure out the genomics of this virus and trying to really go at the micro level, number one. Number two, these mutations are worrisome. Not all mutations. So it has been almost a year, I would say now, this virus mutates. And I give the example when human beings reproduce, our children don't look like us, right? They look like us, but they're not like identical clones. They have some, I would call it a mutation. It's a combination. So they look different. Similarly, when a virus reproduces, a virus like coronavirus, it will have some rearrangement, and those mutations are not consequential. That still is a coronavirus. It's still going to behave similarly. At the same time, in our families, when you have a family of 100 or 200 people, sometimes one family member is not just looks different in the way their face or their features are, but they also behave very different. They can be a criminal. They can have some very bad tendency. So this time, that's what has happened. This particular mutation, the B117 from UK or the one in South Africa, clearly is more transmissible. 30%, 50%, 70%, that range is wide. That is worrisome because if a virus can increase its baseline, actually, and it's a longer mathematical answer, I won't go into the details, but if you had two options for this virus to become 50% more deadly versus 50% more transmissible, it would have been better if it was 50% more deadly. And I know this sounds counterintuitive, but when you do the math, by 50% more transmissible, it will increase the number of infections by such a magnitude that the total number of deaths will be higher in that scenario. So yes, it is worrisome, but I must say the speed with which we're catching up with this virus. If we had unified, if we had clear messaging, and if we all agreed that our collective interest trumps our individual interests, I think we have the science to crush this pandemic.
I want to pivot back to the vaccines for a bit, Dr. Younus. There's, multiple options that people are talking about. I want to ask you, though, about the difference between vaccine hesitancy versus asking legitimate questions about scientific efficacy of data, because that's something India specifically is struggling with. We have two options at this point. We have Covishield and Covaxin. On both, though, we do not have clear enough data. On one, in fact, we have received clearance while this vaccine itself has not cleared phase 3 trials and has not shared any of that data. The response amongst some has been that this is questioning scientific logic and this is anti-national in nature. How would you respond, to those arguments? And do you think it is a legitimate ask to demand that scientific data is shared amongst people who will take these vaccines?
Good questioning is at the heart of science. We've gotten this far by good questioning. And I think it's very sad that Mitali has to ask this question to Dr. Younus. Because if I'm the CEO of those companies, I would take it a personal affront, right? I would be everywhere trying to field all the questions and trying to answer them because I'm in the best position. I have the data, right? So honestly, I think what transparency deserves here is for the leaders, and I'm not picking again on, I don't know honestly all the details, what's going on in India, but it's better to speak in terms of broad principles. Let's pick on US and say Johnson & Johnson is about to get another vaccine approved next month or hopefully this month. If there are questions about Johnson & Johnson vaccine, who do you think is best suited to answer them? It's Johnson & Johnson, right? And if they put themselves out, if they say to every media, and if I was the CEO, I would say, look, for the next 1 month, I'm available to any one of you. And all of my answers will not be, again, Mr. Know-it-all. At many places, I would say, look, here are the difficulties we're facing, here are the barriers, here are the risks and benefits, and that's why we're making this decision. If you think there's a better option, let me know. When you approach people like that, you build trust. And I'm always a big believer that human beings can be trusted. Every country, you talk to people honestly, just like a father does. What do we do at our own homes? There's so many decisions that are difficult for a parent. You can't buy everything, you can't fix everything, you can't get all the furniture you need, you can't always buy that plasma TV. I mean, all those choices. And what do we do as parents? We have a real conversation with children. Look, I have to pay your bills, I have all of these debt. What do you want me to do? And the children actually have appreciation for the father because they understand the struggles. So what my point is, these questions should not be even directed at someone like me who is 3 steps removed, who's reading third-hand information. It's a tragedy, actually. I think people should come forward and take these, and there are a lot of legitimate questions, by the way. I absolutely agree with people who have legitimate questions. And unless we address those, we're not going to get out of this pandemic by a silver bullet of something called vaccine.
Would you say, though, that regulators are justified in green-lighting these kind of vaccines without proper phase 3 data? Is that something regulators should do?
Same question asked differently, right? Same answer given differently. I don't know the difficulties they're facing. I'm sure there is a risk benefit equation behind the curtain. I'm sure they're worried about the spread. I'm sure they're feeling the pressure of these new strains. I'm sure they're looking at economic indicators. And I'm sure there can be 100 other motivations. The reality is they need to come out and discuss those things openly and say, look, these are the pressures. And our model tells us that if we don't do it now, this is the cost we may be paying. I've always used the word risky in my tweets, and people always look at risk as bad. But if you, in reality, risk is not always bad, right? Risk is two-dimensional. Risk means you may win big or you may lose big, right? Starting a cricket match with a spinner, first over giving to a spinner rather than a fast bowler is risky, right? Typically is not done. That doesn't mean it's wrong, because if that spinner takes a wicket in the first over, you're going to say, wow, what a brilliant move. So my point again is, any government that approves a vaccine that has not gone through published phase 3 trials is taking a risk. They may look really good 6 months from now. That risk may work for them. But my strategy for them would be, please come out, be open, discuss the barriers, the difficulties you're facing. Trust your people.
The reason I, asked this question in multiple forms, Doctor, is also about where India then stands in the global perception. India has been seen as a very influential and very active vaccine exporter. And vaccines, like you said, do depend on public perception. Would you say the current steps taken of having pushed through certain clearances without properly seeing the efficacy of data might be a misstep by India in terms of its export potential as well?
Give it 12 months and you'll know the answer, right? This is the kind of risk. In 12 months, if these vaccines end up improving access for 50 other countries that are poor or they don't have the resources to get anything else, and they're able to squash the pandemic, you're going to look like a hero. Or the worst, the other side is, in 12 months, if we circulate these vaccines to 24 countries, we vaccinate everyone, and it ends up that a lot of people who got vaccinated still got COVID. And if history says that these vaccines were 30% effective and the cost was not worth it, it may damage the industry, it may damage the name and the trust for the future. So that's all I'm saying. I mean, this shows you how humbling a profession medicine is and how humbling science and research is. We really don't know all the answers.
What's also happening, I'm not sure whether it's directly linked with the data not being released efficiently, is that at least in India, doctor, there is a high degree of vaccine hesitancy. Among smaller sample surveys, it is as high as 55 to 60%, including some health workers as well, who aren't very keen on taking this vaccine. How would you address that side of the problem?
That's exactly right. So when you have phase three data, that is why we do phase three trials, because phase three trials are typically done on 30,000 people. So you have a large enough number and you can detect rare side effects. You can answer the questions about efficacy with some certainty, and you can publish that data. Moderna and Pfizer, both, if you Google it, you can find those 70, 80-page documents that they submitted to FDA. They were made available to public 2 days before the approval. Any layperson could read them. So this is how you reduce hesitancy, because then you're able to tell people, look, 15th in my own hospital, I told people, and I was the first one, and I didn't choose it. My team chose me to be the first one for whatever reason, to get the vaccine. And I had to sell it to my own heart before I could sell it to anybody else. So I really delved down into that data. And if that data was not there for me, there is no way. I probably still would have taken the vaccine because my team wants to, but I could not have, with a straight face, told my team members, my brothers and sisters, that yes, it's safe and you can take it. Because you have to understand, vaccination is done on perfectly healthy people. Perfectly healthy people. They have a risk, but they don't have a disease. And the first principle of medicine is do no harm. We know that we may or may not be able to do good, but we are always worried. That's the Hippocratic oath we take. First, do no harm. And I cannot answer that question in the absence of a phase three trial unless you show me that data. So that vaccine hesitancy that you talked about, I, I feel bad, but I have to tell you the truth. I think it's legitimate.
Any key lessons that you would want to share about the post-vaccine period as well, doctor, just in order to address this hesitancy? The Indian government has some stipulations such as you must stay on a half hour after getting these vaccines. Any learnings already from that?
Sure. So there is data and there's personal experience. I've gotten 2 shots of Pfizer myself. At this stage, 4 to 5 million people in US have gotten either Pfizer or the Moderna. Globally, that number is over 10 million. Chinese vaccine, Russian vaccine, if you add all of that. Once again, I can talk about the Pfizer and Moderna because that's where the data is most published. First, once you get a vaccine, you should be observed for 15 minutes at the very least. If you have a history of allergy, you should be observed for 30 minutes. You should carry an EpiPen with you. And I say this because every healthcare facility is different. The infrastructure in Sweden could be very different from an infrastructure in a village in Maharashtra, for example. So wherever you can be forearmed yourself, carry those protective medications with you. After that, expect some side effects for a couple of days. A lot of people complain of, oh my God, mera bazu bahut dard kar raha hai, my arm is sore. That's very, very common. And number two, do expect some body aches. You can have tiredness, fatigue. You can have a little bit of a fever because your body has received a message, right? These vaccines are supposed to do something. So we're trying to trick the body that the real coronavirus is now inside, and you have to build antibodies. So your body is working very, very hard, and you're going to feel that fatigue, those symptoms. In 90% or more of people, those symptoms go away within 2 days without doing anything. You can take paracetamol or whatever works for you. And the most important thing is the long-term side effects, in by a large degree, I would say, is a hyped up, self-generated sort of frenzy. Typically, long-term vaccine side effects are 1 to 2 in a million. They're very rare. 99% of vaccine side effects manifest themselves within the first month. They're usually short-lived, and they go away without leaving you with any harm. So that's what people should expect after a vaccine.
Um, I was recently reading an open letter written by the Pfizer CEO, Albert Bourla, where he said, you know, I want to congratulate and thank the almost 44,000 people who selflessly raised their hands to participate in our trial. But these trials, doctor, were held in Argentina, South Africa, Brazil, Turkey, countries that will never, or at least not in the recent future, get these vaccines. Options like Pfizer and Moderna aren't even options for countries like India. Are we witnessing, and I hate to use the term, but are we witnessing vaccine apartheid as we speak? Has COVID sort of marked even sharper lines between countries who can and cannot?
Inequality is probably the biggest challenge in our world today. If someone put a gun next to my head and said, pick one word that describes our world today, I would say that is inequality. That inequality could be between faiths, it could be between genders, it could be between economics, and it could be between healthcare. That's not to justify it, but that's just to say that we have accepted or tolerated at the very least. I think we have tolerated that inequality when it favors us. When it does not favor us, we raise a red flag around it. So there's a lot of introspection. If you look at this last 1 year, uh, there were a lot of countries who could not give their doctors N95 masks. I'm sure India had struggles with PPE because we had struggles with PPE here in America. There was inequality in PPE. There was inequality in remdesivir, an intravenous drug, very expensive, works, does not work is a separate issue. But not everybody had access to that drug. There was inequality in how many ventilators we can give people. Mexico, right south of the border for us, if you look at US versus Mexico numbers, their test positivity is at 40%. I mean, the virus doesn't know I've just crossed a line or a border, right? And now, when you have vaccine, which is such a precious, rare commodity, in my opinion, this is my biggest worry. I am worried about the quality and safety of the vaccines, but I'm much more worried about the unequal distribution. And whether you use the word vaccine apartheid, whether you use anything, but I think we have to look at the big picture here. This did not happen randomly. This is happening every day at stock market, right? But we've accepted that. This is happening every day in restaurants where the person who serves the food cannot bring his own family to eat in the same restaurant. Isn't that true in India? And I can tell you that's true in Pakistan. That's true in many countries. Pakistan is my motherland. I mean, that's my heart. But unless we address those real issues, those are the source. This is not happening in a vacuum. I just want to make a point. Vaccine inequality is not happening in a vacuum. It's yet another fruit of the same dirty tree, which has all forms of inequality. But we sort of tolerate it when it helps us. You know, the day when I'm enjoying that meal with my family, the thought doesn't cross me that this waiter, can he also bring his family here? But anyway, I'll stop there. I think you got the point.
I have, but I, wanted to get your sense of, in that context, how you think the next year and a half might pan out. Because here we'll have a situation where by summer, perhaps most of Europe will be vaccinated, whereas if we're lucky, maybe 30% of India will be. That creates much bigger diversions, does it not, Doctor, in terms of economic opportunity or travel or, opening up economic borders as well?
Absolutely. I think this is like a wildfire and seems like we are sort of on our own, like every country. WHO must be working very, very hard. But again, I don't think that we have strengthened WHO during this 1 year. If you look at it, they've been attacked from every side and they've been politicized. Everyone can make mistakes. Yes, they may have made mistakes along the way, but I don't question their intent. So, how do you bring equality or the kind of issues you're raising? There has to be one international body, right, that we trust, that we empower. We have only marginalized, undermined that body. Now, there are going to be consequences for that. The consequences you're mentioning It's really painful to think what you said earlier was spot on, Mitali, that countries like Argentina, Brazil, Turkey, who took the risk and they volunteered for a product, cannot get the same product. All they get is a thank you for your service, but we can't get you a vaccine. So what this means is the pandemic will drag out. It will drag on. For some countries, it may end in 2021. For some countries, it may go on for a year or two. Travel will be restricted. For the rich and privileged, who may be able to get a vaccine by 100 different means, they'll have a certificate, they'll be able to fly. Airlines may mandate vaccination. They may start asking for vaccine certification. I think Australian airline already started it if you want a long international transcontinental flight. So again, that inequality will play out. My worry, though, is that we will become numb to it in a year or two. And I say this for a reason. If you look at tuberculosis, another infection, it kills 1.5 million people every year. Every year. It has been killing for God knows how many years. Where is the big noise about it? There is none, because it's not killing. Those people are not dying in the Western developing countries. They've been dying in rural areas and underdeveloped countries. So unfortunately, that's my worry. If pandemic is cured in the affluent world, it may become forgotten.
What are the bigger lessons we would draw scientifically from this, doctor? You were speaking of WHO, and this month we understand that a WHO team plans to visit Wuhan. They want to understand this better, even as many scientists have pointed out that this is a function of our own conveyor belt lifestyle, where we chop down forests, we chop down areas to consume more and more and more. Do you think these kind of visits will bear any fruit? Are they lessons that we might learn for the future, or are you not that hopeful?
I'm always hopeful. I think there's always people are good. I think world moves in the right direction. So I'm always an optimist in those conditions. But there are certain specific steps that we all have to agree to, right? Number one, we have to agree whether WHO is that body or not. Because if we are going to undermine an international body, I think then we're kidding ourselves. We can't have it both ways. Anytime you allow someone to lead, you need to understand they can make mistakes. They're human beings. They have a it's not easy to lead, right? Leading is hard. So that's step number one. Step number two, the lesson here is collaboration works beautifully. On January 10th, when the Chinese professor Zhang made a decision to publicly share the genome of this virus, I mean, people cannot understand the consequences, the positive consequences of that step. All the testing that was created, all these mRNA vaccines, much of the research that happened, all got triggered from that one point. The kind of cross-pollination, BioNTech is in Germany, Pfizer in US, and they're coming together and creating a vaccine. The kind of fast publication speed, the amount of data that has come on pandemic, on this coronavirus in 1 year. I didn't see that much data on HIV in 10 years. I mean, it's unbelievable, beautiful lessons. For a Pakistani-born American doctor to be talking to an Indian journalist and worrying about not just Indian people, but all people. I mean, what else we need? These are all beautiful things in my mind. I think this virus has brought us together. It has shown us the humanity in us. I hope we can hang on to all those lessons.
Indeed. One question I wanted to ask you, and I'm sorry I didn't ask you that earlier, is how you see the prioritization that governments are doing in terms of vaccinations. For example, for countries like India and in the US, priority is to healthcare workers, senior citizens, whereas you have a country like Indonesia that is choosing to do it differently and vaccinate the working population first. Are there any, is there any wrong or right here in terms of how to structure this?
Yeah, tough question, because again, I'll have to understand the intricacies of every country, why they're doing what they're doing. I can tell you about US. I believe we have anywhere between 20 to 40 million healthcare workers, how you count them. and they're on the front line. So not vaccinating them is like sending soldiers in the wars without guns. So if they go down, it's not like we're protecting them. We're protecting ourselves when we give it to healthcare workers. Number two, 40% of all deaths in US have occurred in nursing homes. So clearly nursing home becomes our second priority. Number three are essential workers, people who are driving buses, delivering pizzas, working in banks, so many who are running our society. And number four, then you come age and all other factors. So I think that to me makes sense. That is how it should be in most countries. And I think that is what WHO and most international bodies have endorsed. By the way, one thing for your viewers, I don't make up stuff. I read science and I try to align myself with real, true science. I'm not the author of any of this work. Science is a team sport. So I like to stay with the evidence where the evidence is leading us. What that means is if any country wants to deviate from those priorities, they better have a very good reason. Because I don't think that there is any conflict or confusion about the priority list I just shared with you. Children are in the end because these vaccines have not been studied in them, number one. Number two, they're extremely robust, great results from children so far. So that list of prioritization, I believe, is pretty consistent across the scientific community. If any country wants to deviate from that, once again, the burden is on them to come forward, explain their rationale. So their public in this globally connected world does not read on Twitter from someone that they're doing something wrong. I mean, just stay ahead of the narrative. And I'm sincerely suggesting this to world leaders because you will not be able to stop information from your members. They're going to read stuff and then they're going to feel, why are we different? So why wait? Come forward, explain it to your family, your people, why you're doing something differently.
By when do you think, doctor, we could expect pediatric doses? I mean, here in India, children have not attended school for an entire academic year. And it seems, as we were talking about hesitancy, it is high for administering it to one's children as well. Any developments in terms of the pediatric doses that one can expect this year?
Sure. So both Pfizer and Moderna are now starting pediatric trials. They're gradually, and we knew that, they're gradually decreasing the age from 16 to 12, and then I'm sure it's going to be 8 and 10. I will not be surprised if within 2021, we have enough safety data that at least these two vaccines will be approved for pediatrics. That's my hunch. You can agree or disagree. This is not science, that's just my opinion. Number two, which is even more fascinating, if you have community control, you may not even need to immunize children the way things are today. Because if we have good community coverage, earlier you said 50% vaccine hesitancy, if we are able to vaccinate 90% of adults, what will happen? You'll have community control. You'll then be able to open schools because the chains of transmissions will not work. When you look at the survival rate of children, it's amazingly good. Thank God. I hope it does not change. You can have full schools, you can have your society back to normalcy. So we can, yes, we can wait for vaccines to come for children, but if we can't fix our adult mindset, I mean, you know then where the problem lies.
One final question to you, Doctor, which is through 2020, I think much of what people dealt with was the mental exhaustion of seeing a pandemic through, its impact on your lives. Uh, as we turned into 2021, there was a lot of hope around the vaccine, but there are negative developments as well. How do you deal with the mental exhaustion when you're basically trying to look at an end line? You want to see when this ends. You want a definitive end to this nightmarish situation, as it might be for people across the world. Really, I don't think there's a single individual who's not been impacted by COVID.
Absolutely. I'm not a mental health expert, so I think a lot of people may know this better than me. But the reality is, we got to teach people how to live with this. What I have seen is bad public messaging. I think we're very polarized. There's one message that is saying, shut down, lock down, stay home. And then there's another message that's saying it's all garbage, no need for masks, no need for anything, just live your life, right? And we have spent a year in that polarization. I think the right message, if we, and it's still not too late. Because I don't know, this may take a year, this may take another 2 years. But we need to tell people this is like learning how to drive. You don't just give anybody keys and say, go on the street. They'll wreck their car within 10 minutes and die, right? So what do we do with driving? First, you read a book, you understand the rules. Coronavirus is similarly. You read some rules about this disease, educate yourself. Number two, when you get a car, you put a seatbelt on, right? So when you go out, you wear a mask. Number three, when you drive on the road, you keep safe distance with between cars, right? You don't tailgate. So when you're outside, avoid large crowds, keep some social distancing. So from that driving metaphor, we must tell people there is a safe way for you to live. There is a safe way for you to go to school. There is a safe way for you to fly. There is a safe way for you to even socialize. Go out in a park, run, travel, even meet your families. Focus on how to live safely rather than saying shut down, lockdown, or just go all berserks. And I say this because every country can do this. All this requires is sincere public messaging. This is not dependent on pharmaceuticals. This is not dependent whether the virus mutates or not, whether vaccine gets here today or not. This is something that's so simple you can start doing it tomorrow. Like, why can't the national TV, let's say in any country, pick 3 of your best physician communicators and have a question answer every night on national TV where people can ask questions like you're asking me? Because I've done this in my hospital, by the way. I'm not just making it up. In my hospital, I have a call with my team where they submit questions, and the only agenda I have is your agenda. Whatever questions you have, you're going to answer them. If you did that for just 2 months, I think you'll deplete all possible questions. People will understand how to live with this pandemic, and then they will stop worrying. They will not even ask the question, when will it end? Because they're moving on with their life. This question comes when we paralyze people, when they're hurting emotionally, when they're hurting economically, when they cannot see their parents and their children. Then yes, there is a pressure. But I think you got to tell them, look, you can do all of that, but safely. And once we do that, and I think then you let science catch up, and hopefully it will not remove all that mental exhaustion, but I think it will mitigate it to some degree, because that's what I'm doing for my family, and that's what I tell my family members.
That's a fantastic point, Doctor. I really, really appreciate your time today. Thank you so much for joining in. In fact, on the point about taking on questions, I noticed that you were considering quitting Twitter, and I must implore you not to. You have so many fans and well-wishers really across the world. We love what you have to say, and we love the way you put it in the simplest terms. So please do stay on that social media platform. Everyone's listening and everyone's learning from it as well. Thank you very much.
I cannot thank you enough. And please, from my side as well, what keeps me up at night in the morning, despite everything on Twitter, what keeps me on Twitter is when people will send me a random tweet saying, I don't have any doctor in my village. We've taken screenshots of your tweet. We've WhatsApped it. All of us read it. And thank God, because all of us are safe. So I want to make sure people understand that personal fame, if anything, it bothers me. It makes me uncomfortable. I'm a nice private person. I want to go back home once this pandemic is done. But I do feel the burden that if God has blessed me with something, I think it's time for me to share. And I wish everyone the very, very best of luck. I really look forward to traveling around the world and meeting all of these people at chai and samosas and really enjoying it once we are done with this. So my best wishes to everyone.
Thank you very much. And you have an open invitation whenever your travels get you to New Delhi in India for chai and samosa. Thank you very much again, Doctor.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.